So checking your ankle rotation. So commonly what I see is this kind of missed an assessment. Hands on your hips, and all you're doing is, can you turn and pivot? This left foot is going to resupinate, so that means kind of arch raises up. Keep that big toe kind of down on the ground. What you'll see is some people just kind of lift their whole foot up off the ground. So you want to keep that big toe down on the ground, toe flexed, and you'll feel the kind of rear foot kind of resupinate as you do that. Check it in comparison to the other side. And again, should feel that kind of supination in that foot. What should happen is, kind of as you kind of twist and pivot around this right foot, your left foot should pronate. Okay, and the same goes, go that way, and the hip is allowed to kind of drop in. Okay, pronation is not the devil. It does happen, and it's a case of seeing how it functions. Again, kind of we can see what happens when our kind of knees come in valgus. So getting the feet to pronate. See, does that have an effect in comparison to your kind of left or right, to your left? Okay, then just go into kind of our heel raise. See what's happening. Can you see that kind of rear foot come up and kind of invert at the very top, where you see that kind of heels come in as you're facing forward, and or if you're looking at it from behind, heels coming up and coming in. All right, so there are your kind of basics. Obviously you want to check your gastroc, which is straight knee, and your soleus, which is bent. So the soleus is probably the most important muscle when it comes to kind of assessing the foot and ankle. It absorbs a lot of the kind of force when we're running, and it's a pretty important muscle when it comes to running and kind of lower force absorption and production.